A 69-year-old man, fatigue and intermittent headaches, episodic blurred vision over 4 months, easy bruising and numbness in his fingers, mild pallor, dilated tortuous retinal veins, anemia, markedly elevated ESR, high total protein, low albumin, smear shows low formation, bone marrow biopsy reveals small lymphocytes with plasmacytoid differentiation. Which of the following is the most likely diagnosis? So this is a classic case of Waldenstrom macroglobulinemia. Patient has headache, episodic blurred vision, dilated tortuous retinal veins, which are classic symptoms of hyperviscosity syndrome. Also has very high total protein, low albumin, causing the protein gap just like multiple myeloma. Also there's an M spike on serum protein electrophoresis, under low formation, which we talked about in a previous multiple myeloma video. And this is how it looks. This RPC is clumping. All of that is due to IgM paraproteinemia. As the disease causes monoclonal proliferation of plasma cells just like multiple myeloma, but causes overproduction of IgM, not IgG, not IgA like multiple myeloma. And this is very, very high yield. But with an important distinction is that it doesn't cause overproduction of mature plasma cells like multiple myeloma, but lymphoplasmacytic cells. Also on bone marrow biopsy, there is more than 10% beta cells, not plasma cells, versus multiple myeloma. So the question here asks what is the most likely diagnosis? And there is no Waldenstrom macroglobulinemia mentioned. So were we wrong? Should we just choose multiple myeloma? Actually, this is why I made this video, to remind you with a simple note that Waldenstrom macroglobulinemia is a subtype of non-Hodgkin lymphoma. So the correct answer is D. And here are our side notes which I recommend you to read.